The very first step when doing an evaluation about the appropriateness of an intervention, what we call a MAPAC evaluation, MAPAC is an acronym in Spanish, is the first step, I say, is focusing the problem. Usually, very, very usually, there is no specific question from any clinician asking you about appropriateness of a given intervention. They state the question as a topic or as a thematic issue. So you have to do a big effort to be very, very, very specific in writing down a question with the 4 elements of a Pico question to start a MAPAC evaluation, right? We need to narrow the scope of the problem they are addressing us. So if the question is stated as a topic, we need to do a specific question, or more often, more than one question. Every single question would be written down in patient intervention, comparison, and outcomes. I know this is a very unusual way of writing questions for you, but I'm sure if you repeat this with any single question that are raised to your mind in your clinical rounds or wherever you are, you will be very experienced and this will be very easy for you. Alternatively, you can do it after each one of the meals. In 1 week, you will be very proficient with this. So, patient intervention, comparison, and outcome. The Pico structure allows us to accurately identify these are the advantages from the Pico question. And you know them because I presented to you before. So let's go away. This is the way of writing down, and it allows you to focus also the search. Because in the patient column, where you should be very, very specific or very clearly specified, you will join all the synonyms by using the or, and you will connect them with the others using and. These are the optimal study design that you know. I want to go very quickly through this. The hierarchy. And this is the problem. Sometimes, based on the proposed topic to be evaluated, more than one Pico question can be made explicit. What is the problem here? If we have 2 questions in the clinical ground, I think there are very, very easy criteria to use. One is is this urgent more than this one or not? And this is a very severe condition or less. So urgent, and severity are 2 criteria very good for the clinical ground. But here we are not there. We can use several criteria to prioritize the questions. Criteria will be used by all parties involved in the evaluation process. All the stakeholders you can imagine. Clinicians, methodologists, economists, whatever. For example, severity of the process, the number of patients affected by the evaluated procedure, etc., etc. But grading of recommendation, assessment, development, and evaluation places special emphasis on the importance of outcomes to prioritize clinical questions. Let me go into this. They suggest a thermometer from 1 to 9, being 1 less important and 9 critical for decision. So in the case of a MAPAC evaluation, we need to be very explicit in the Pico question, very explicit in the outcomes for harm and for benefit. So we end up with an exhaustive list of all possible outcomes that are important from the patient point of view. That means that you have to go to the patients to know what are important for them. If you don't have patients at hand, you can do it by yourself, knowing that you are not a patient, at least not a usual patient. And great people tell us to collapse all this thermometer into 3 groups. 1 to 3 are those outcomes of low importance, 4, 5, and 6. They are important, but not critical for decision making. And finally, 7, 8, 9. These are outcomes critical for decision making, and these are the outcomes we should take for doing our evaluation. You can have more explanation about this in the handbook of the grade approach. You see down there, handbook for grading the quality of evidence and the strength recommendation using the grade approach. This is an open source, so you can go freely to it. For example, we wonder about the beneficial effect of nutritional supplements in the frail elderly person suffering from a pressure ulcer, a very common problem. We know that nutritional status plays a fundamental role in the ability to respond to noxes and in the plastic capacity of our body. Our list of outcomes could include 6 outcomes: nutritional status, quality of life, ulcer healing, energy intake, mortality, or improvement in microcirculation. If you were the patient, how would you rate the importance of each? In your right, I offer my rating. Yours could be different. This is an example taken from somewhere, I can't remember, but useful for this. 9, mortality. 8, ulcer healing. 7, quality of life. Very important. These are the outcomes that will be taken into account for our Pico questions. What about nutritional status? Could be important, but not for our decision. Energy intake, who cares? Improvement in microcirculation, the less important thing. So we will go to 7, 8, and 9 outcomes. In addition to defining the Pico question or questions, if there are more than one or more outcomes than one, derived from a topic to be evaluated, it is advisable to know and record other information. We propose you, when you are doing a MAPAC evaluation, an evaluation about appropriateness, to consider which service or person requested the evaluation, what is the scope to which it refers. By default, it's RN Center, but sometimes these evaluations are relevant to a bigger area. Baseline situation, useful for monitoring change. If there is something that is inappropriate, you know what is the baseline. You implement some actions, we will see later. You monitor the change, and you get the change. And which one would be responsible for the evaluation? When going to get documents, there is another hierarchy, as we said, with design of studies. This applies to documents. The higher in this pyramid, the less effort you have to do to get the evidence, because someone has done a lot of work for you. I will not go in depth into this, because I'm sure there is another section that will deal with searching, and you'll know that. This is the 6S from Brian Haynes some years ago. There's another example. This is taken from Schunemann. Suggest the P, the I, and the C, and the outcomes. A 13-year-old girl who lives in rural Indonesia presented with flu symptoms and developed severe respiratory distress over the course of the last 2 days. She required intubation. She shares her living quarters with her parents and her 3 siblings. At night, the family's chicken stock shares also this room, and several chicken had died unexpectedly a few days before the girl fell sick. So the potential intervention is antiviral oseltamivir to these people and to this girl. And this is the framing that Schunemann suggests to us. P, population avian flu patients, intervention oseltamivir. Comparison, no pharmacological intervention. Outcomes, 4 desirable and 3 undesirable. Some of these outcomes are important for the patient, but others are only policy outcomes. This is just an example that is given by Schunemann, as I just said, but now I want you to go to do your own exercise. This is a very simple one too, not very difficult. And this is the scenario. A colleague from a nearby hospital, knowing that you are engaged in a work group that evaluates the appropriateness of health intervention, the MAPAC group, asks you to help him to evaluate the initiative of his hospital. In their hospital, they are trying to start a delivery underwater because some enthusiasts think that this mode of delivery reduces the duration of labor and decreases the need for analgesia and anesthesia without side effects. I ask you to put this topic in a Pico format with desirable and undesirable outcomes. Remember which of them are important. Write as many questions or as many outcomes as you need. The Cochrane Review can help you, and the Cochrane Review is Immersion in Water During Labor and Birth from Clute Elizabeth, and is published last year. So please go and write as many Pico questions as possible from this scenario. Good luck.